Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large group of people. Please don't be scared of the virus. Follow the precautionary measures. Stay home, stay safe.
Welcome you to today's update, and I would like to invite the Director of Health Promotion and Education at the Ministry of Health and also the leader of our risk communication team, Mr. Modou Njie, to present the 20th report on the COVID situation in the Gambia. Mr. Director, you're welcome.
Thank you very much, Prince Abubakar Aminata Sankano. I'm giving this statement or delivering this statement on behalf of the Honorable Minister of Health, Honorable Hamid Samate, and giving you the current situation of COVID-19 response in the Gambia. And the statement reads: the 20th National Situation Report since the confirmation of the first case of the novel coronavirus COVID-19 in the Gambia on the 17th of March 2020 revealed the following. 1. All 6 new laboratory tests resulted from MRC were negative. Over 80% of all calls to the 1025 hotline were received from Western Region 1 and 2 health regions. That is from Brikama Health Region and as well as Kanifi Health Region. The 4th case is still on admission and is responding to treatment. No new people admitted or discharged from quarantine yet. All 4 confirmed cases in the country since the beginning of the pandemic were imported. Globally, since 31st December 2019, and as of 8 April 2020 at 1100 hours, a total of 1,518,773 cases of COVID-19, which are in accordance with the applied case in the affected countries, have been reported. Of this number, 88,505 deaths were registered and 330,589 recovered from the disease. Senegal recorded 244 confirmed cases, 113 of them recovered, and 2 deaths. Currently, at the country level in the Gambia, we have 39 people on quarantine in one of the hotels in the Greater Banjul area. A total of 201 tests were conducted and 4 were positive. 195 test results were also negative. 253 people completed quarantine, 233 contacts traced, and 310 people completed follow-ups. Regarding risk communication and community engagement, case management, logistics and security, surveillance and laboratory, as well as coordination, the following activities were carried out. 1. Engagement of rural communities in countering the fake news against national COVID-19 response activities and the denial of the presence of the disease. 2 successful field visits were conducted. The first that focused on community of Numel in URR with 1 registered COVID. Numel community has registered 1 COVID case, which resulted in peaceful transfer of contacts to Basse for quarantine, sensitive dialogue and sensitization. The second field visit assessed the preparedness of the officials of the points of entry in North Bank and South Banks of the Gambia, and also sampled also local languages with support from partners, private sector and individuals. We also will embark on capacity building and continuous engagement of dedicated COVID-19 media corps. We'll also embark on engagement of inspectors of the State of Public Emergency Regulation 2020 and documenting best practice of compliance while identifying challenges that require urgent attention in the interest of public health. Finally, I would like to take this great opportunity on behalf of the government of the Gambia to thank the people of this country for solidarity demonstrated during this period. I would also like to thank philanthropists from the various areas, the private sector, individuals and charitable organizations for their continued donations and support towards the fight against COVID-19. I would like to conclude by commending all health workers, communication practitioners and security personnel for the hard work and sacrifice you are doing for the people of this country. I thank you all for your kind attention.
Thank you very much, Director Modunjai, for that brilliant and flawless and seamless statement on behalf of the Honorable Minister of Health, Dr. Ahmad Lamin Samate. We now open the floor for questions from the media corps.
Good afternoon. My name is Mood Lamin Sarangaritan. So I just have one quick question, perhaps a clarification. You said you've noted that there is this discrimination and stigmatization, but you didn't back that with examples. I don't know if you can cite examples so as to bring the meaning closer and as to what steps you're taking to address that.
Okay, I'd like to invite. Okay. Yeah, thank you very much. I mean, like I said, the government, the way we are working, we believe in privacy protection. And it's very important. There are close examples. He mentioned a community in URR where we went. We engaged the elders. They said that wherever their people goes to the other locality, people will hold in their mouth and say, you people are from this community, you people have a case. And there's also another case in Bundu, whereby the people in a particular community were discriminated against. They came and talked to us that wherever they go, members of their community are even accused of hosting an imported case. So those kind of examples, we engage them. I mean, the Minister of Health spoke about it in one of his statements. And Director Modunjai, in his media appearance, has repeatedly done something about it. And this is something that is ongoing because it's a part of the dynamics of communication. So it's our strategy that is something, in addition to the denial, fake news, stigmatization and discrimination is something that is coming up. Because even people who finish quarantine, when they are about to be released, there were some who said that they should keep them there. They've not broken any law. They've not committed any crime. It's not a crime. I can become a victim of COVID-19. So I shouldn't be discriminated against. So because of that, and we try more sensitization, I'll invite the director to elaborate on that.
Thank you very much, Sankano. Basically, the issue of stigma and discrimination are very difficult areas to penetrate. But what we need to do now is to do the assessment. And also we were listening to some community members and those people who have also gone through the problem of COVID-19. And that is why we decided to take it upon ourselves to engage the opinion leaders, the community leaders, family members of those people who are affected, the friends of those people who are also affected, so that they understand that those people they are discriminating or stigmatizing against, they should definitely get those people closer to them. That is what has been our mission, and we are able to achieve what we are supposed to. But still now, we will still continue. Because as you know, as we are still in the pandemic, we don't know when we're going to have other cases. So before that, what we need to do now, we need to clear the area. How do we clear it is to ensure that those people who are already affected and they are in the villages, we need to go out and talk to those family members. Although it will be difficult for us to address the problem at this point in time, but gradually, as we are talking to them, we'll be able to make them to understand that those people who are living with the disease can still be productive as they were before. And that's the message we have been sending out. And then the moment they have been treated, meaning they are free from the virus, and they cannot also transmit anyone else again. So that is that message has to go to them, for them to understand that, so that they can also be able to get these people closer to them. And that has been our focus, and we'll still continue to work on that. Yeah, thank you.
Thank you very much, Director, for that elaborate response. Yeah, have additional question? Any more? Yes? Well, Gambia, our constitution is against discrimination. And anybody who is discriminated against somebody, you can lodge a complaint before the police and the matter can be prosecuted. But for now, we are trying to engage the people because, we are all affected. And so it's about, educating the people. But there's a law against discrimination. Our constitution made it clear. If you discriminate against a person or an entity, that person or affected entity has the right to go to court. So it is against the law to discriminate people based on whatever reason. Any additional question? If there's no additional question, then we wrap up today's presentation. On behalf of the National Health Emergency Committee, and that is the Risk Communication Subcommittee under the leadership of the Director of Health Promotion and Education, Mr. Modunja, I would like to thank you all for your attention. See you tomorrow. Have a pleasant break.
Coronavirus exists. Coronavirus is a disease that attacks the respiratory system. The symptoms of COVID-19 are fever, tiredness, dry cough, shortness of breath, headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large group of people. Please don't be scared of the virus. Follow the precautionary measures